Dr. Daniel, I see a lot of teenagers, and because they may be slightly early in their journey, that their diagnosis is not clear,
Hmm.
a lot of young people with hypermobile EDS do have a increased rate of other psychological issues such as ADHD, anxiety, depression, autism, and OCD. And that tends to get in the way, I find sometimes, of physicians saying, oh, well, we can send you to psychiatry or a
Yeah.
psychologist.
Hmm.
But you were somewhat fortunate in having a genetic diagnosis, which sort of validated your situation. But as you know, most people with hypermobile EDS, until we get Dr. Norris's test out, which only finds will find 30% of those young people. There's this validation issue, and as you may have gathered from the meeting today, there are not that many experts in EDS making a diagnosis or understanding it. It really is a very broad condition. So, can you talk to us about either your own experience or those of some of your patients who are not believed?
Yeah, that's a really good question. And I got to say, my journey was one that was long as well. And then, um, as well as other patients that I support, their journey was long for a diagnosis and misdiagnosed. I was a gymnast by trade, to be honest, and a competitive gymnast. A lot of my patients were dancers, athletes, where all of a sudden things just did not work. And
Hello?
As I'm usually told, and it was really challenging. And then going to doctors and trying to have a good understanding. And we need to have a balance of, um, I believe, uh, what they're feeling psychologically as well as medically. And I believe in the circle care of team because more times than not, I've had patients come to me and said they think it's just psychological, or I'm just feeling this, or it's a part of my anxiety. And I'm not here to say that it's not. There's not a relationship with EDS and anxiety and EDS and depression. But what comes first, right? That feeling of misunderstood, misdiagnosis will lead anyone to feel anxious and anyone to feel sad or depressed or not able to do what they truly want to do in life. So I believe as a part of the circle of care, um, that patients should have the supports of mental health right at the beginning, especially what even going through the process of testing and the process of diagnosing. Because although it could be great to get the diagnosis, it's always then what? What does this mean? Right? What is my prognosis? What does it look like? And everybody with this diagnosis, I always say, it's not a one size fits all model. We have to treat each patient independently and see what their needs are in the moment. They're always the best indicators. I know I show different indicators, but they're always the best indicators of where they're at and what they need. It's truly a different model. And one thing that as I said, I'm wearing the hat as a professional, but also as a patient, and I could understand the trials and tribulations working through the system and getting the supports what you need, especially that whole time of denial. I got to say, it took me 2 years of denial. Oh, I don't have that. How could I have that? Right. And then when something bad, because I have good days and bad days. In this recording, I actually had pneumonia, but I made it through. I recorded last week with pneumonia. Like, you don't know how it's going to be. Today's a good day. I'm so happy to be in attendance, but you never know what tomorrow will bring. So I got to say, being a patient with EDS as well as supporting people with EDS, flexibility is key. And my goodness, just going through the ups and downs, they learn how to build upon flexibility. It's quite amazing. I'm still
How
learning.
how did you how did your family help you in any way, or how did your community help you? Can you kind of describe that, because that really is, I find, fortunately, most of my families, the kids that I look after, they have amazing parents, in
Yeah.
particular, amazing mothers who
Hmm.
stand by them to the nth. And
Hmm.
I don't know if you can share either your personal or are you, how important is now keeping the family healthy? Because this is a huge stress on most families.
It is. There was that feeling of like who had it? It is like my father, my mother. There was that self-blame, that going through that. There's a mourning process as having a diagnosis. Um, it's I always say how much, I let people into my circle of what they need to know and who could support me and deciphering what it is. It's a learning for all of us. And sometimes the patient becomes the educator, and in all systems within the family, but also within in the medical system. And it becomes quite challenging. And but I realize that my community, my supports are very important. But it's also very limited because I sometimes you people feel that they know what they're doing and they're giving these advice. And out of care, I've heard from you got to eat more. You're eating too much tofu to you're not sleeping enough, to all these other advice of medical and mental health. And sometimes it just, you're just listening and you're like, sure, I'll try it. You'll try anything. And it's not just my anxiety. I would say it's the whole family's anxiety at times when things are going bad. It's really just trying to monitor and balance, really.
So there's a couple comments in the chat. So one person is asking, I'm not sure if you are involved with this kind of research, Dr. Daniel. Have you studied the role of ketamine infusions that are used for pain, but also through lived experience to improve mental health and coping skills?
You
Are
know
you
what?
able
I
to comment
haven't
on
studied that, but I heard of that. And I haven't. I think through my lived experience, it's really just about finding balance, what works for me. It's something that I am going to look more into, though, but that's not in my research at this
that?
time.
Okay.
Yeah.
Yeah, I think there's a fair amount of literature in
Yeah.
psychiatry, at least. I think in pain, it's evolving. There's not great evidence for it, but I think we're still trying to sort out like how do we even do these infusions and what frequency and what's safe and because there's risks with these kinds of things
That's
too.
right.
They're not just these benign things that make everybody feel amazing, right? So yeah,
No.
I don't know that the jury's out on that, but it's certainly evolving. Then there's a couple comments. Okay, same person. This approach has been used in patients with ME for generations. Although this is useful in all illnesses, has created a lot of harm in treating these patients and blocking the few research resources and clinical resources to look at ways to provide recognition for the hospital. I'm concerned about this approach. Have had ME for more than 40 years, and despite CBT, symptoms are worse and life challenging. Yeah, I think the challenge here too, and maybe you can comment on this, Dr. Daniel, is we haven't had good treatments for these conditions. So in the absence
Not
of
at all.
great medical treatments and medical knowledge, we do resort to supporting the patients as best as we can with the impacts on their quality of life, including psychological impacts. So yeah, and I think that might lead to a perception, at least, that, oh, it's a psychogenic illness because this is the only thing we offer our patients. But, I think people here today know that that's not the case. So do you want to just comment on that?
One thing that a lot of patients that I've seen over the past few years with EDS, when I ask them of what are their modality of treatment and supports, they always say that they've been to psychiatrists or they've been to other mental health care clinicians, and who kind of did a one size fits all model. CBT, MI. There's other ways of which is motivational interviewing. Um, and other systems of care. Those are only a few approaches. When you look into health psychology, though, you're going to have those bad days, and whatever approach you try, it's to manage your pain, to manage your sleep. It takes time and it's very difficult. I think it's really good to have different approaches, but understand that it's again not a one size all model for our patients. And we have to look at different approaches. That's why I said the circle of care team. I do believe that when I was working in the hospitals, in different clinics for specialized care and different complex disorders, I always made myself available right at the beginning of and my inpatients and outpatients, that I'm like, I'm going to come to the circle, I'm going to come to the table, I'm going to support in assessing when we were doing the rounds, just because I just believe there's more than um, medical. There's a mental health aspect as well, but I believe that we need to look at their social, emotional, medical, physical, all everything of supports. And sometimes it's true, that's not offered, especially with EDS patients.
One thing I found about this organization, Dr. Daniel, is they do a lot of support for each other. There are a lot of avenues where individuals who have these conditions can get together in different support groups. Sandy can, and a few others can talk about their, Jackie can talk about the supports, but I think not feeling alone on this journey is very, very important. Knowing you have other people on your journey, and some people are, a bit stronger, more outspoken, but positive. Some people may not be so positive. And I think you sometimes need to know that you're not on this journey alone. And I think everyone who came today, you are not on this journey alone. And with these scientists trying to look at the cells and what's going on in all these things, why are my cells not behaving, not responding, not reacting? But I tell all my patients that there is going to be some therapies that are going to be really quite life-changing. They've been able to take genes and take it out of a family, put it into a mouse. Once we get into more genetic therapy in the future, and it will come, then we may be able to get, tremendous relief. But I do find that this is a very interesting thing where the researchers and people who have these issues and those of us who are caring for you have to maintain hope that we will
Absolutely.
increase our knowledge. And that's how I keep most of my patients going. I said, I just came back or heard a meeting this weekend. I've learned so much today from all the speakers. And then it's managing that time that it's going to take. And, when you're a young person, especially, you think about today and you're not really thinking about when you're older. Then those who are a bit older, and as you get older and older, this is the whole thing of maintaining hope, because this is a challenge. I must say, this is a huge challenge.
hmm and you talked about those. There are support groups, and one of the things that I realize just from some of my own patients saying, you got to choose what support groups that are out there as well. Um, you know, and how are they supporting you? We all want to feel supported. It is really important. We want to feel that we're not alone. Um, but also, there's groups out there that there's clinical groups, there's support groups, there's people with lived experiences that are holding their own groups, and trying to make a difference. And I would say that again, it's trial and error what's out there in those groups. Some people feel that their one-on-one are better than those groups because they feel anxious or fears what is going to happen in those groups, or to face like what the future may look like. Again, I always say it's the type 2 error of anxiety. Type 1 is like what is currently happening. And sometimes when we talk about the future, it's kind of scary, especially as I said, these are all preliminary studies and research, and we're getting into the development of what the future will look like for EDS and HSD patients. But it's scary because it's the uncertainty of the unknown. We don't know. And sometimes living in that gray area, if I don't know and it's not absolute, that's scary in itself. And sometimes that's the discussion we need to have.